They're barking.
All right, should we do this?
Yeah, let's go.
Excellent. I will be the surgeon.
Okay, I'll be your assistant technician.
Sounds good. Stefan can be
I'll be the
spectator.
spectator.
Start.
Hello, I'm Dr. Bouchot, the attending physician. I'm here to assist and guide you during this operation. Today, we will be performing a long bone fracture reduction on the fibula. Remember to keep your hands above the operating table and in front of you at all times. This helps to ensure we maintain a sterile operating field and prevent later wound infection. Look at these x-rays. As you can see, this is a significant fracture with misalignment of the broken bone. It will need to be surgically reduced. Pick up the highlighted scalpel from the instrument tray. Squeeze the handle button to pick it up.
Here's a scalpel.
Surgeon,
Thank you.
align your scalpel in the position indicated. Now, make an incision along the marked line. Well done. The scalpel should now be
Wow.
carefully placed back on the tray. Set it down in the ghosted spot on the tray.
Wow.
Pick up the highlighted surgical retractor from the tray. Now place the retractor in the ghosted position over the incision. Re-grasp the retractor and squeeze the handle button to gently open the incision. By dissecting your initial surgical incision, you can now see the patient's deep tissue. You will need to further dissect the deep tissue by using a scalpel again to make a deeper incision, exposing the fibula. You will do this using the same steps you just performed for incising and spreading the skin. Pick up the scalpel. Surgeon,
Thank you.
align the scalpel in the position indicated.
Okay.
Then make an incision in the deep tissue. The scalpel can be placed back on the tray.
Okay, there you go.
Surgeon, grab the highlighted retractor. Replace it in the indicated position and squeeze the handle button to open the deep tissue. Nice work.
Yeah, there's the
We've
fracture.
exposed the bone fracture, but it looks like we will need to remove the blood and clots to better visualize the fracture.
Yeah, that's kind
On
of...
the instrument tray, grab the forceps with the gauze on it and use it to remove the blood and clots from around the bone fracture.
Okay.
Excellent. You can now see the bone and
Oh, yeah,
fracture
it's a lot
clearly.
more
Place the
clear.
forceps back on the tray. It's time to reduce the fracture by approximating the fractured ends of the fibula bone. We do this by aligning the fracture to its anatomically correct position. Surgeon, grab the leg with both hands where indicated. Then twist your hands to align the bone and approximate the fracture.
Okay.
Nice and gentle. Remember the Hippocratic
Oh, yeah,
oath.
it's a lot better.
Do not harm.
Yeah.
Now look at the fracture and make sure it is correctly anatomically approximated and you are satisfied with the position.
Yeah, I think it
In
looks
this
good.
next part of the procedure, you will secure the fractured bone in place by affixing a metal plate over the fracture with screws. Pick up the metal plate from the tray for positioning on the bone. Surgeon, you will then place the metal plate on the bone where indicated over the fracture. Good. All right, pick up one of the screws from the tray and place it into position over the metal plate. Grab the orthopedic power screwdriver from the tray. Now, surgeon, use the screwdriver to drive in that first screw. Pull the trigger when you have the screwdriver in position. Okay, repeat this procedure 3 more times with the other screws.
Thank you.
Final screw.
Last one.
Great job. The placement of the plate and screws look good. Place the screwdriver on the instrument tray.
There you go. Thank you.
Time to close up the surgical wound. Remove the retractor and place it on the tray.
There you go.
We're going to use a skin stapler to close the surgical incision.
Okay.
Grab the stapler from the tray. Surgeon, position the skin stapler as indicated to place the first staple. Once in position, squeeze your handle button to use the stapler. Continue stapling until you have good approximation of the surgical wound. You should have a nice, tight wound closure.
One more.
Set it down in the ghosted spot on the tray. We have some bleeding that should be cleaned up. Grab some gauze from the tub on the tray and clean up that blood. Place the gauze in the tray and you are finished. Well done. We need to check a post-reduction and closure x-ray of the lower leg to make sure everything still looks good now that we've closed the surgical wound. Here are the post-reduction x-rays of a similar reduction. The x-rays from your surgical reduction should look like these x-rays. A nurse will clean and dress the wound. We should clean up and consult with the family. I'm sure they're anxious to hear how the surgery went. That was a very successful operation. Nicely done.
Great work,
Good job,
guys.
surgeon.
Yeah. Thank you.